The goal of Agia Marina Chrysochous community was to develop a plan to tackle energy poverty. The Cyprus Energy Agency supported the local authority with capacity building activities, providing help for the diagnosis of the phenomenon of energy poverty and the identification of possible future actions in the area. In the first month, online discussions provided a better understanding of the local needs and the target of the local authority to shape the tools for diagnosis. Even though at the proposal stage the intention was to give an emphasis to elderly people, following the changes in local and global circumstances in energy provision and costs in 2022, the target group was enlarged to include all households in the local authority to better understand all vulnerable groups. The local authority of Agia Marina Chrysochous and other communities in the area are disadvantaged in terms of public transport connectivity as well as access to a diversity of job opportunities. The staff of the local authority has communicated that many residents have decided to change their jobs or even quit their jobs following the fuel crisis after the Russian invasion in Ukraine and the changes in the financial situation of the island after COVID-19. The decision was to collect data that represents approximately the 15% of the total households of the local authority. Due to the General Data Protection Regulation and time and distance constraints, the staff of the local authority implemented this activity. After a physical capacity building session, the trained staff spent a few weeks to conduct the survey. They collected the data during home visits using filled-in paper forms to get a deeper understanding of the household energy and thermal comfort conditions and to identify how the residents are impacted by energy and transport poverty. In this way, the trained staff was familiarized with the home visits and the face-to-face data collection following the guidelines, toolkit, and demonstration by the Cyprus Energy Agency. The data was collected from 50 households in the community of Agia Marina Chrysochous. The content of the household survey includes data on the building condition, the building envelope, the socio-demographic characteristics of the residents, the heating and cooling use, the lighting and technical equipment and appliances, the windows and ventilation, the thermal comfort through self-reporting, and the spending on energy. The results showed that the majority of the building stock is older than 30 years old and with a non-insulated envelope. Despite the fact that the local authorities are by the seaside, there seems to be no significant issue with humidity and dampness. Also, the fireplace is used to a significant extent for heating in the winter, as locals have their own wood from agricultural activities. Interestingly, despite the small sample of houses, it seems that there is greater thermal comfort in the summer, thus there is satisfaction with cooling conditions, than in the winter, thus there is dissatisfaction with heating conditions. This was already communicated by the local authority based on their experience during the first collection of qualitative input. Gaps were identified in understanding the impacts of energy use on the overall well-being of people living in the community in order to propose potential soft solutions as well as large-scale retrofits. Despite the fact that the expenditure on energy, both for the heating and cooling and other household needs, as well as for the transportation needs, was included in the questionnaire, most respondents were not willing to share such information. A comparison between the spending on energy and the household income would have been a very good indicator if the data was available. The household survey conducted in a face-to-face way might dissuade people from responding. The local authority needed and still needs the active support of an expert to develop the energy poverty diagnosis because there is a lack of technical and administrative capacity. Continuous guidance was needed to better and further understand the phenomenon of energy poverty, its symptoms, and treatment.